Nearly 500 million people worldwide live with a chronic respiratory disease. Every year, over 3.5 million lives are lost to COPD and asthma combined. These are not rare conditions. They are preventable and they are treatable. And yet, for decades, they have been overlooked, underfunded, and underestimated. So 2026 is a turning point. Last year, world leaders gathered at the United Nations to sign a new political declaration on non-communicable diseases. Chronic respiratory diseases finally took their place at the table. But declarations, they're only words. 2026 must be the year of action. So today, we speak with WHO's Special Envoy for CRDs. This is EUFOREA News. Hello and welcome to EUFOREA News. I'm Dr. David Bull. As we enter 2026, the global respiratory health community stands at a crossroads. The September 2025 UN high-level meeting on NCDs delivered a powerful political declaration. So chronic respiratory diseases, including asthma and COPD, were recognised as a priority alongside cardiovascular disease, cancer and diabetes. But recognition alone does not save lives. Implementation does. And the gap between global policy and the patient in clinic remains vast. Well, to discuss how we bridge that gap, I am thrilled to be joined by a leader who has dedicated his career to respiratory health on a global scale. He is the World Health Organization Director General Special Envoy for Chronic Respiratory Diseases. And it's a great privilege to welcome Mr. Jose Luis Castro. Very good to see you. Thank you so much indeed for joining me. Let me start, if I may, with your role and mission. Now, you took on this role in September of 2024 with a clear mandate, and that was to elevate respiratory health on the global agenda. So as we begin 2026, what progress have you seen, and also what remains your greatest challenge?
Thank you very much. When I took this role in 2024, chronic respiratory diseases were largely invisible in the global agenda. I used to refer to them as the Cinderella of public health. The day that I took this job, I had researched in the New York Times to see how many times there have been a story about chronic respiratory diseases, especially COPD, and I found one. It was an obituary of the singer Sinead O'Connor. And that year, nearly 3.5 million people died of these diseases. So I was astonished, by the lack of coverage. That has changed. In 2025, there have been three major developments. The World Health Assembly approved first in May the Integrated Lung Health Resolution. In July, the United Nations Economic and Social Council approved the recommendations of the WHO Director Generals regarding inclusion of chronic respiratory diseases, ending the institutional silence of chronic respiratory diseases at the UN. And then finally in December, the United Nations General Assembly approved the political declaration from the high-level meeting on non-communicable diseases, which for the first time mentions chronic respiratory diseases alongside other major diseases like cancer, cardiovascular diseases, and diabetes. Our biggest challenge now is going to be implementation and the translation of those commitments that were made globally to the national level to bring assistance to the hundreds of millions of people who are affected by asthma and COPD.
Now, let's then look at moving from that declaration to what actually that means in action, because as you rightly say, of course, the September 2025 UN high-level meeting resulted in that political declaration and therefore commitments towards 2030. So the question I have for you is, What exactly does the declaration say? And much more importantly, I suppose, in many ways, what does it actually mean in practice for patients with asthma and COPD?
First, I think the political declaration matters because it creates responsibility. It says to governments that chronic respiratory diseases can no longer be ignored or postponed, until there are resources to be addressed. So governments have the responsibility to act on this and to work to ensure that these are included in the national health plans, so that there can be access to diagnostics and appropriate treatments for patients. That, I think, is the major significance of this political declaration, the establishment of responsibility and accountability, which wasn't there before.
So how do you go about ensuring these commitments then actually translate into real change? It's one thing to have that declaration. You say that obviously it makes it a sort of, it makes it there that it's apparent to the countries that this is what they need to do. But actually, how do you then translate that to ensuring that real change does occur and that patients' lives do improve?
This commitments, and especially the protocols for treating patients with asthma and COPD, are part of the primary healthcare systems of countries, that resources are there to train staff, to provide medications, and also to identify new patients. I think that's very important. The early detection of people who are affected by COPD ensures that they are put on treatment early and that the disease can be managed more effectively. Many times, these patients come into the system at a very late stage when it's very difficult to treat and more costly to the system.
And I know that prevention is at the heart of your message, whether it's about tobacco control to addressing air pollution, for example, early life risk factors. Now, on the 19th of June, EUFOREA is going to host a high-level summit to redefine CRDs as preventable diseases. I know you are going to be a keynote speaker there. How important is it to recognise secondary and tertiary prevention as key pillars of action?
Sure, we must stop treating chronic respiratory diseases as inevitable. These diseases can be largely prevented by implementing effective tobacco control policies, by reducing air pollution, and also, as I mentioned earlier, by diagnosing earlier, by having systems to diagnose those who are affected earlier, and that they are put in treatment effectively. So I think that we have seen, we have effective tools and policies in place that can be implemented and can prevent millions of people from getting sick from developing these diseases.
Now, beyond governments and obviously the WHO as well, there are other organisations which do play a critical role. I just want to highlight, for example, EUFOREA. Well, it's made it a priority to support busy clinicians with practical guidance whilst also empowering patients through comprehensive education. The question I have for you, though, how do you see the role of organisations like EUFOREA in the current landscape?
Sure. I mean, WHO and governments cannot do this alone. The task is huge. There are over 500 million people affected by chronic respiratory diseases. So we will need a lot of organizations like EUFOREA that help to translate these policies into protocols and into actions to benefit the patients. I think that's the real role in the collaboration with other partners in the field, to ensure that we are able to reach every patient, and that we're able to ensure that every patient is managed effectively.
And just on that, if I may, just finally, your vision, I think you've articulated it extremely well, with enormous clarity, ensuring that every individual, regardless of their circumstances, has the opportunity to breathe freely. So as we look ahead to the rest of this year, 2026, what is your message to policymakers, to healthcare providers, and also to those all-important patients around the world?
I think that breathing is a fundamental human right, and we must ensure that we put this on the forefront of our policy decisions, that we bring to the public attention, also to the politicians, to the policymakers, the importance of implementing effective policies that ensure that the air that people breathe is clean, that it is smoke-free, and also that the patients have access to tools to diagnose any disease that impedes their breathing.
Well, it's been such a pleasure to talk to you. Thank you very much indeed for your time. That's Mr. Jose Luis Castro.
Yeah, thank you very much for having me here. It's a pleasure, and I look forward to working with EUFOREA and colleagues.
Well, there you have it, an absolutely fascinating conversation highlighting the roadmap to prevention of chronic respiratory diseases through vision, dedication, education and cooperation of multiple agencies, all with the singular aim of empowering and helping patients. Well, many thanks indeed to my guest, to Mr. Jose Luis Castro. Now, you can find more information about EUFOREA and also register for the EUFOREA educational events on the euforia.org website, where you can also sign up to receive the latest news via email. Also, we are on social media. Please do follow us. We're on YouTube, X, LinkedIn, Spotify, Instagram and Facebook. Until next time, goodbye.